Hi, I'm Laurie. Welcome to our West End clinic at Ossington. I'm one of the pelvic physiotherapists, and I wanted to talk about prostate surgeries and why it's useful to come in and see a pelvic physio before you have prostate procedures. Most fellas don't know how to contract the muscles of the pelvic floor, and they're deep inside the pelvis, and most people don't know where they are or how to feel them, and so they don't have a good motor pattern. They just happen with movement. And what you want to do before your surgery is to optimize that so that you've got a good motor pattern. Typically your surgeon will say, no physio for 6 weeks. But the downside is that's prime healing time. So what you want to do in that window, a couple of days after surgery, get going, start gently. It helps both venous return so that you're getting swelling out of the area, and it helps the muscles to regain that motor pattern. A lot of times after prostate surgery, prostate procedures, because the prostate sits right on top of the pelvic floor, and then the bladder sits on top of that, you lose some of your bladder control, and then sexual function can be impacted as well. So I'm always keen to see fellows a couple of times, and then after the 6-week mark or after they've been cleared by their surgeon, they come back and see us.